Howdy, and welcome to Let's Talk Texas, the official podcast of the Texas House Republican Caucus. I'm your host, Jordan Overturf, Communications Director for the Caucus, bringing to you a great interview with Dr. Tom Oliverson. And this is a timely interview because this week the House is going to be debating House Bill 18, his important prescription program to help 3 million Texans who are either underinsured or uninsured to lower the cost of prescription medication. So this is a great episode where we talk about that bill specifically. We talk about healthcare policy. We dive right in. And then we also talk a little bit about grunge music. So make sure you stay all the way to the end of the episode. I had a great time talking to Dr. Oliverson. I know you're going to enjoy this episode. Let's talk Texas. Dr. Oliverson, how is your session going, sir?
We are so busy, Jordan. I mean, I think we filed more bills than we've ever filed.
Okay.
And we've been passing a fair amount of those and making some good progress. We've got our big must-pass bill for the insurance industry has passed out of the House. That's the credit for reinsurance. That's a really important piece of legislation because what it does essentially, it conforms Texas law to the International Covered Agreement. So folks may or may not realize that reinsurance, basically, those are the insurers of the insurers. So whenever the insurer runs out of money, then the reinsurance policy kicks in. And the way reinsurance works is, let's say I'm an insurer that insures against hurricanes.
Okay.
And so I've got all this coverage for insurance of hurricanes along the Gulf Coast.
Okay.
And a big hurricane comes along like Harvey, and it just wipes me out. You know, all my premiums I've collected, everything is spent. I have a reinsurance policy that prevents me from not being able to pay claims because there'll be a company like AIG here in America or Swiss Re or Munich Re over in Europe that's basically taking hurricane risk along the Gulf Coast, and they're bundling that together with risks in Thailand and China and Japan and, you know, along the coast of Norway and, you know, other places like that. And the idea is it's like super pooling of risk, right? So you're taking global risk and you're bringing it together with the idea that it's not gonna be like the day after tomorrow where you have hurricanes on every coast all at the same time. And so if we didn't pass this legislation, our domestic insurance companies would have lost access to all those worldwide markets for reinsurance, and it would have drastically increased our property and casualty insurance rates that consumers would pay. So it was a really huge deal. It didn't get a lot of fanfare. It's kind of technical, but we got it out of the House. It now heads over to the Senate, and that was our true must-pass for the insurance industry.
This is why I was excited to bring you onto the podcast, because just right into the weeds right away.
Yeah.
You dig right into all of this stuff, and certainly as the chair of the insurance committee, so many people are focused on the healthcare aspect and the COVID response. But you know, Texas has a lot of different insurance needs that we focus on. So. I guess for you, as you look at some of the big priorities, obviously getting that piece passed was important for you. And your management of the insurance committee, what are some of these other victories that you're kind of trying to look to get up on the board this session?
Sure. So, you know, we can talk a little bit about healthcare. We've talked a little bit about property casualty. There are some other things that we're working on that will be important, but I think the credit for reinsurance was sort of the big property casualty bill that everybody was really counting on. With respect to healthcare, I think the issue is, you know, there's really a lot that we can do within the market we already have to improve affordability, to improve access, to improve competition. And so one of the things that we've been focused on in the insurance committee is some of these ideas about improving transparency with costs. And it's kind of a multi-committee work. I have a bill that's gone through the Public Health Committee, was heard last week. It'll probably be voted out on Wednesday. that has to do with hospital price transparency. Chairman Burrows actually had a really good bill, which I think is going to help a lot of consumers, is House Bill 2090, that basically requires health insurers to have a cost comparator tool on their website where consumers can actually shop around and actually figure out what their out-of-pocket costs could be. I believe very strongly that the reason why healthcare is so unaffordable, well, first of all, let me say I don't think we have an access problem in Texas. I think we have an affordability problem. There are a lot of people who are uninsured not because there are not options for them to purchase coverage to access insurance, or to access coverage, to access care, but because they can't afford to pay the premiums on the options that are available. Healthcare is just too freaking expensive. And so really, I think when you look at what makes healthcare different than any other market that we have in our economy, for better or for worse, the fact that there's no ability to comparison shop is what drives the high prices. It's too easy to hide. There's no good way for a consumer to know in advance what they're going to pay. I use the example, if you watched the press conference last week, you heard me say the same example, but I'll say it again because I think it's very valid. Would you ever buy a car from me if I told you went to the dealership and I was trying to sell you a car and I said, Jordan, you're going to drive this car off the lot and I'm not going to tell you how much it's going to cost until a month after you start driving it?
Yeah, no one's buying that.
Nobody would buy that.
Yeah.
But that's how all healthcare works, essentially, with the exception of cosmetic surgery. And the reason cosmetic surgery doesn't work that way is because it's all cash. Right? And it turns out,
I am completely,
enough,
you were educating me completely on this, because I am one of the many people who doesn't really understand healthcare in general and how to wrap my mind around it. And I think most folks are on my level, and like you said, they just want to know, how much is it going to cost?
Right.
What is it going to cost me to get this done so I can make that decision? Why has it taken so long to get to this point in terms of transparency and pricing? And are you confident that we're going to see success on this?
Oh, yeah.
And it seems like you're building on last session's success in terms of what you were doing with surprise medical billing
Right.
back then.
And let me just say quickly, since you brought that up, that Senator Hancock, Chairman Hancock, and I have a big plan this session. It'll be one of those things that probably won't get noticed too much until after the session's over. But we intend to have ground ambulances included in 1264 surprise medical billing by the end of session, which is the last man standing. And that means that patients will finally be protected from every source of surprise medical bill. So we're pretty excited about that. He's doing a really great job on the Senate side, kind of hammering out the agreement with the stakeholders and getting it worked out while we're working on some of the hospital price transparency. But look, I think we will get it done. And since I think we are probably we're talking to an audience that is mostly on the Republican side of the aisle, I would just point out, President Trump got criticized, I think, unfairly for a lot of things. I also think he didn't get credit for some of the really good things that he did. I believe that history will reflect that one of the biggest things that he did, which was not seen by many, but was noticed by people like me who really pay attention to healthcare policy, was his executive order on price transparency. We are building in Texas upon the successes of the Trump administration with respect to that executive order. In fact, a lot of what Chairman Burrows and I are doing comes directly from Trump's groundbreaking executive order. The reason we need to make it state law is because an executive order is easily overturned, right? Not to say that I think Biden would be stupid enough to repeal an executive order on price transparency for healthcare, but it could go away. So we're going to make it state law and make sure that the citizens of Texas can finally see, what the cost is. To answer your other question, I think the reason why it's taken so long is simply because these are contracts we're talking about between providers and plans, right? And when you think about the data that's contained in a contract, there is an argument to be made that some of that information is proprietary, it's confidential. It's between the contract and the two contractees, right?
Yeah.
However, as the first circuit court in D.C. ruled last year on Trump's executive order, what we find is that, in fact, insurance companies do disclose to consumers what those contracted rates are. It's just that they don't give them that information until after they've already received the care. And what we're saying is, no, if you're going to disclose that information anyway, we would prefer that you give it to the patient before they chose the care so that they could figure out where the value was.
When did that start? Like, because I remember many years ago in the beginnings of these conversations, especially pre-Obamacare, discussion about, you could just go to a doctor and pay him for the services that you were getting, right? When did that change, and how did we get so, in my estimation, topsy-turvy?
Well, I mean, I don't know when it began, but I will tell you that I feel very strongly that the ACA Obamacare really messed it up.
Okay.
If you remember the conversations going all the way back to 2008, or 2009 when he first came into office, the conversation was supposed to be about bending the cost curve down.
Yeah.
But there was one broken promise after another with the ACA, and ultimately, what it became was single payer light, right? And
not so light on the pocketbook.
Well, no, that's right. And in fact, because of all the mandates that they put into the coverage and the requirements for coverage, and look, these are things that make sense to people, right? I mean, should people expect to have coverage for breast cancer screening? Yeah, I think that's reasonable. Mm-hmm. But every time you add a mandatory coverage onto an insurance product, you increase the cost of delivering that product. And so when they gutted competition by basically banning a whole cornucopia of health coverage options that people were picking, and they weren't like, gold-plated, these sort of, quote, what we call Cadillac plans. You heard that a lot during the ACA. They were skimpy plans. They didn't have as much coverage, but they worked for people. And they got rid of all that and forced everybody into these, full coverage, that's the term we like to use, right? Full coverage plans. Mm-hmm. And it dramatically increased costs, and at the same time it reduced competition, reduced choice, and that even increased costs more. And then when the penalty went away and people finally could breathe a sigh of relief and say, you know what, I don't see the value in the exchange plan. I would rather not have insurance than overpay for something I'm underutilizing.
For sure. And my personal experience in that and trying to use that whole marketplace was, the cost was prohibitive, but also the doctors that I could get to were out at least an hour away. So at what point am I really saving anything if I'm having to drive an hour when there's a clinic right around the corner from me, right? And
the sad part about the ACA, the saddest part in my mind as a taxpayer, is that the only people who came out ahead that were purchasing plans through the marketplace are people who were getting government subsidies to purchase them. Now, if you can qualify for a subsidy, then yes, your premiums are low. But you and I are paying for that.
Yeah.
Hence the term subsidy. Mm-hmm. The other big win on ACA, if you can call it that, was Medicaid expansion. But again, 90% of the cost borne by the federal taxpayer, they came within one senator's vote of actually repealing that 90% and shoving 100% of the cost onto the state a couple years back, you may remember. So the idea that this is just going to be free money that we're just going to get forever, I think is really sort of a short-sighted and foolish statement. And even if it is, the cost to the taxpayer is staggering. It's staggering. We're talking hundreds of billions of dollars.
Well, and to that end, we're trying to focus on making sure taxpayers are protected from a number of things, and funding these additional programs is continuing to put that burden, but also as they're seeking care themselves. One of the big bills that you have is related to prescription costs. Yes. HB 18, is that correct?
HB 18, or Texas Cares.
Yes, sir.
We like to call it. So look, here's the thing. In the pharmaceutical industry, we know that prescriptions are overpriced. We know that every non-generic brand name drug that hits the market is the asking price. To borrow another car analogy, so that I think that's something everybody understands. The manufacturer suggested retail price, right? The MSRP, everyone knows the sticker price.
Yeah.
Is way above what the actual value of that drug is. And by value, I mean the price at which a manufacturer would have to sell that drug to cover their costs and make a reasonable profit. The reality is for everyone who's insured, they're not paying that price. Just like if you went to buy a GM truck at the beginning of the year and you had to pay the sticker price, you overpaid, because if you waited to the year end, there'd be a $15,000 rebate off the sticker.
Yeah.
I mean, so that means they marked the vehicle up when they started selling it by $15,000. Really, that's what that means, right? That's built in it's baked into the cake. And the same thing is true in pharmaceuticals. So what House Bill 18 does is it goes out there and it creates the same exact mechanism to draw down manufacturer rebates that are available, and it gives them to the little guy. It gives them to every uninsured or underinsured Texan that currently doesn't have access to them. So that now, finally, for the first time, Texas as a state, once this bill passes, everybody's on a level playing field. We have effectively, with this bill passing, we have effectively reset the price for insulin to what it should have always been, which is the fair market value of the drug.
So how does it specifically work in terms of getting those funds either to those folks who are uninsured or underinsured?
It's a great question.
Yeah.
So mechanically how it works, the state will have a fund that's set up. It's a trust fund.
Okay.
And basically when a person has a card, and anyone in Texas who is a lawful permanent resident will be eligible to participate in this program as long as they're not currently having a prescription benefit program through their employer.
Okay.
Or some other benefit program they have.
Gotcha.
So as long as you don't get it, now it doesn't matter. You could be insured. You could have a high deductible plan. You could do health sharing. As long as you don't currently have a prescription drug benefit plan, you're eligible. So you get your card, you go to the pharmacy, you say, I need insulin. You hand them the prescription, you hand them the card. We have contracted with a company, a pharmacy benefit manager, who's out there negotiating the most aggressive rebate they can get on behalf of the 3 million people who are likely participating in this program, and it will be big. We're talking 60, 70% off of the suggested price. Huge discount. The pharmacist processes the prescription. You're participating in the program, so automatically the drug is discounted by the value of the rebate, and then you only have to pay what's left over. So instead of paying $400 for a month's supply of insulin, you may be paying as little as $50.
Much more manageable.
Totally. Now, we're not offering to do it for free. This is not an entitlement program. And I think one of the beautiful things about the two things I think conservatives will love about House Bill 18 is that, number one, it's totally self-sustaining. We have the trust fund. The trust fund makes the payment of the rebate to the pharmacist, so the pharmacist is made whole. At the end of the year, the rebates come in from the manufacturer and they fill the trust fund back up again. So the trust fund never runs out of money. It's auto-replenishing every year. So we pick up right where we left off on January 1st, and we start the whole process over again. So it just auto-renews, which is a beautiful contrast to so many of the programs that we have in Article 2, which are entitlement programs, where we're actually spending taxpayer dollars in an ongoing fashion year after year after year, more and more and more. It's never enough.
Yeah, and some of those programs are rife with fraud, and we're losing out on those dollars going to people who truly need care because that fraud runs so rampant sometimes. So how much does it take to start the fund? And you said it'll keep revolving. I mean, 10% of the state's population is a not insignificant amount of the people who will benefit from this.
My guess is probably 5 times the number of people who would benefit from Medicaid expansion.
That's a big figure to throw out there.
Yeah. I mean, it's huge. Now, look, I'm not offering to give it to you for free.
Yeah.
I'm also not offering to pay for your surgeries and every other healthcare need you have, which, if you're entitled to Medicaid expansion, you obviously are going to get more benefits. I make no bones about that. Mm-hmm. But this helps more people. This may actually reset the entire marketplace in Texas so that some of these drugs actually are repriced at fair market value.
And it's smart that it is replenishing. It's using a system that's already in place, but it still allows people to go out there and just get through that. I don't know. Is it red tape or is it just this? How do you describe it for someone who doesn't understand why that sticker price comes out so high?
It's the same reason why General Motors sells a pickup truck and marks the price up by $15,000 and then gives you a rebate. It's because people are addicted to rebates. People think they're getting a deal when they get a rebate. So what happens is the pharmacy benefit managers know this, and the manufacturers know this. And so the manufacturers want to get on the formulary. They want it to be their drug and not their competitor's drug that people are getting when they go to the pharmacy. For like Dell, let's say. Let's just take Dell for an example. They have a plan. They have a benefit program. Dell gets these rebate checks at the end of the year just like the state would, just like Texas Cares would.
Yeah.
But it comes in and they can do whatever they want with the money. It doesn't necessarily go back to the employee. And so the problem that we have is that everybody in this country, in this pharmaceutical space, is fairly well addicted to these rebate dollars. And so they don't mind overpaying for the drugs at the point of sale as long as they get the big fat rebate check at the end of the year. Manufacturers know this, and they know that the only way they get on the formulary is by offering a huge rebate. So they mark up the cost of their drugs so that they can give an even more aggressive-looking, crazy rebate. I mean, would you rather have a $15,000 rebate or a $20,000 rebate?
I mean, $20,000, right?
Well, of course. Now, I'm not going to tell you that I marked up the cost of the drug by $5,000 or the car by an extra $5,000 to get you that $20,000 rebate. But all you're thinking is, man, I just got a huge rebate.
And that's the strangest supply-demand model I've ever heard of in our free market economy.
It's crazy. And so we're gonna take the existing system, dysfunctional as it is, and we're going to use all the existing architecture as it's currently working in the system, but we're going to turn all that machinery on its head and use it to actually benefit the little guy for a change.
Well, I tend to think there are a lot of conservatives out there who would like that idea. Yeah. We talked a lot about healthcare, and certainly it is a big part of your lift, at being one of the few doctors in the House, and this being kind of the COVID session. But you've also got other bills that you're working on. You've got a district that you're fighting for back home. So tell us, what are some of the other bills that you're working on this session that you're excited to be bringing forward?
Well, let's see here. I think we have like 55 bills this
okay.
session. So
a light lift, okay.
It's a light lift. Well, so one of the ones that we're trying to get set in calendars right now, which is pretty important to me, very important actually, has to do with the Victims of Communism Memorial Day. Communism actually, as a political system, has been around for a little over 100 years. Mm-hmm. Since that time, it has resulted in the deaths of over 110 million innocent people, more than any other event in human history. And unlike fascism, unlike Nazism, unlike the Holocaust, we don't spend a whole lot of time talking about the evils of communism. In fact, if you go to our colleges and universities, you will probably find professors extolling the virtues of communism, despite the fact that its legacy is essentially that all of its promises are not kept. Equality is promised, inequality is given. Basic liberties are thrown along the wayside, like the ability to speak freely, the ability to associate, the ability to have faith in God and believe what you want to believe, regardless of who you think God is or how you approach religion. All of those liberties are trampled, and in fact, even your life is trampled. It always fascinated me in just an absolute sort of macabre way. At the Battle of Stalingrad, it was very clear that the Russians looked at their citizens not as soldiers, not as fighting for a cause, but they were a commodity. They were willing to throw people at the German machine guns, and one guy's carrying a rifle and the other guy's carrying bullets. And it didn't matter, you know. The Chinese are doing the same thing right now with minorities in their country, you know. There are reports, the WHO had an alarming report that came out recently talking about the black market organ donation trade going on in China, where you have people, quote, you know, hospitals advertising people standing by to donate their heart. Well, these are people in prison camps, really.
Yeah.
These are ethnic and religious minorities that are being exploited because they're a resource. So we need to do a better job of telling the legacy of communism, and something I've been very passionate about. For whatever reason, it ends up not being as easy as of a sell as you think it ought to be. I'm surprised that there are those who seem to quietly, not to my face, but quietly seem to not be in favor of having simply a the victims of communism.
Well,
but it's an interesting crossroads we're at in our country right now.
Is it because the Cold War thawed, the wall came down, and the USSR crumbled, or is it the fact that people just don't remember history the way that it was actually carried out, and they continue to go back to the positive on paper aspects of it? Especially since you look at the history of Asia, and there have been a lot of communist dictators. You've still got North Korea. Things have not improved greatly in North Korea, even though relations between the U.S. And North Korea improved under President Trump's leadership. Going back to Pol Pot, the atrocities that have taken place are factual. There is plenty of history and documentation of it. And even if we're getting into it, journalism used to really call out what was happening in these countries where people were fighting back against communism. And now it is okay for a country like China, billion population, to completely erase a significant portion of its history because it's counter to the Communist Party's narrative. Yeah. The example is brought up again and again that if you try and search Tiananmen Square in China through their if you try and search it there, it's not coming up. Right. Yeah. There's no way for you to learn about your history. And that is something that I think, more and more people are concerned about happening here, because it seems okay to just, instead of remembering the pain and the evil that comes from our past and learning to better ourselves and improve the future, it's just easier to erase it, block it out, so that we don't remember these things that have happened in the past.
To repeat it. Right?
Yeah.
I mean, and it's, if I had one ask for the listeners out there that might be listening to this, call your legislators and tell them to set this bill. We need this bill to pass. This is actually part of a 50-state movement. The National Victims of Communism Memorial Foundation was created and authorized by President Clinton. So this is a bipartisan issue. We cannot afford to forget the legacy that communism has left us. We cannot allow our young people to be swayed by the broken, empty promises. It all sounds so good, but it has never worked anywhere it's ever been tried. Just look at a map. I love the nighttime map of the Korean Peninsula. Have you ever seen that from space?
Yep.
Where you see this heavily industrialized, lit, prosperous, opportunities for success, South Korean portion, the DMZ, and then just darkness.
Yeah.
I mean, the picture's worth 1,000 words.
Yeah, and any concerns of that happening back home are met with fierce opposition, and people like yourself coming down here working hard to make sure that the systems that we depend on and rely on here in Texas and in America are operating the way that they should. So I'm gonna go ahead and let you get out of here. It's gonna be another busy week. We got major calendar items coming to the floor.
Got constitutional carry this week. I'm excited about that.
Yeah.
I've been waiting for 3 sessions. This is my 3rd session. I've been waiting for 3 sessions to have a chance to vote on the constitutional carry bill. I am so excited about
Yeah,
this.
and it's weird because there's a lot of weird stuff going out there about this, but there are a lot of members who are signed on board to these bills. They're co-authored. They're getting out there and pushing for this. So I know we had James White on last week to talk about how he made it through that marathon hearing.
Yeah.
You know,
I want to say one thing with respect to what you said about the grumblings. I hear some of the grumblings too. Look, the first rule of anesthesia is that the enemy of good is better. That being said, if people have ideas for how to make it better, let's bring the amendment. Let's have the conversation, right? But I think we have to recognize that this is kind of a momentous occasion with Texas poised to join other states as far as recognizing the Second Amendment for really what it was put into our Constitution to be, and that is an absolute right of the people to not have their ability to carry firearms to be infringed upon, right? And so, I mean, that's a pretty amazing thing, and I think we should. I'm looking forward to that, right? That's a huge step forward.
Yeah, I mean, the governor made, protecting the Second Amendment one of his priorities during his State of the State. So, here we are. We're going to get a chance to have it on the House floor. I'm going to go ahead and let you get out of here. But before I do, I am curious. You are a chairman. Was there an inside meeting among you guys to figure out who could have the longest hearing time? Is that a session by session thing? You just try and push the testimony into the early morning hours as much as possible?
Great question. Good insider baseball. Good way to leave it, Jordan. I would tell you that, truthfully, there are committees which are always going to have marathon hearings. Mm-hmm. Just because the topics that they're likely to pick up, like you don't sign up to be the chair of state affairs without having your caffeine pills at the ready or your energy drinks because you're going to get hit. The same thing with civil jurisprudence, same kind of thing. That's judiciary that's going to get some bills. Public health this time around has gotten all the abortion bills.
Yeah,
and we're actually going to pick up some really big bills this week with respect to whether or not gender identity, gender modifying treatments on little kids is a good idea. Whether healthcare providers have a conscience right to opt out of treatments that they think are morally unethical. Those are big bills, right?
Yeah.
But to answer your question directly, insurance has issues like that. We're going to have a big hearing tomorrow. But it's not going to be because of one bill. It's going to be because the chairman decided in his infinite wisdom to hear 26 bills on one day.
Okay. Well, I guess we'll have to bring you back next time and we can talk Zen and the art of guitars.
I'd love to do that. I am learning to play. That was my pandemic thing. We were all isolated in our little cubbies, and I decided I wanted to learn to play guitar. So I've been working at it. I've always been a big grunge fan. I'm sort of a child of the 80s into the 90s, and so Stone Temple Pilots, Pearl Jam, Soundgarden.
Okay,
but of course Jerry Cantrell, who is my hero. Alice in Chains.
Earlier generation, and I can talk about Alice in Chains for hours. But earlier generations would have, put up Beatles, Stones. For the grunge generation, though, I feel like it's Pearl Jam, Nirvana. Which camp? Where do you fall?
I'm always been in the Pearl Jam camp.
Okay.
I like, as I said, so I Chris Cornell of Soundgarden, amazing musician. Jerry Cantrell, probably one of my favorite guitarists from Alice in Chains. Just the sounds he's able to get out of his guitar, just amazing stuff. Think about, the difference between like Rooster and Nutshell, for example, especially the acoustic version. You said you like acoustic guitar. Have you played the acoustic version of Nutshell?
Yes.
That's a great song.
Pretty much any guitar player, I feel like any guitar player who has ever played an open mic has played Nutshell at some point in their life. Like
awesome
you give it a shot. But yeah, we can talk about that a lot more. Chris Cornell I love because he is one of the most secular yet spiritual singers of that generation. And if you listen to a lot of the content of his lyrics, he's talking about God and the relationship he had with his faith. So
I used to be, before I got into guitar when I was younger, I used to sing a lot.
Okay.
I actually sang with a professional chorus in Houston. And so I have always admired Chris Cornell because his range, vocally speaking, is top 5 in the world. I mean, there are opera singers that can't do what Chris Cornell can do. I mean, he's an incredibly talented musician.
Yeah, I bow. I am not worthy to him at all.
Yeah.
Thank you so much.
Yeah, my pleasure.
We'll talk about it more down the road. Thank
Sounds
you, sir.
good. Thank you, sir.
All right, thank you again to Dr. Oliverson for joining us. Thank you to you for tuning in to this episode. We've got more coming down the line. Representative Ashby was in here earlier today. I had a great conversation with him, so look forward to that later this week. We'll be having more of our members come in, talk about the big bills that are coming up on the House floor, talk about the successes that they've seen, other bills that are coming through committee still. There's a lot of runway left in this session, so make sure you stay subscribed to Texas House Republican Caucus on Facebook, Twitter, Instagram, wherever you want to find us at TXGOP Caucus. Thank you so much for listening. We'll see you next time.